Ladies and gentlemen, good afternoon, stroke evening. I'm not sure which it is. I must say this is really a special privilege to be here and to talk about the future of healthcare. And first, really to look around the room and say that I think the future is in this room. The challenge is always, and I keep on hearing, is that we have great ideas in Nigeria. We have fantastic policies, but the challenge always continues to be is how do we implement them? And therefore, I hope that over the next couple of minutes, I'll take you through a little bit of a journey, not only from my own experience, but from a little bit of understanding of what's going on there. But to set the rules, I'd like to start by first the basic rules of the future of healthcare. I assume that everybody in this room understands that healthcare is important, is critical, and without health, there's no wealth. I also understand, and you also do, that without us understanding that healthcare is essentially a business, whether it is in public sector or private sector, somebody has got to pay for it. Third is that we do know that there are trends going on worldwide. The epidemiological situation is changing, disease conditions are changing, we're talking about non-communicable diseases more. And at the center of this is the importance of understanding that the consumer, in our case in healthcare, the patient is at the center of all we do. But that is where the challenge is. We talk a lot about the patient, but have we ever stopped to ask the patient, what do they want from healthcare? What do they see as healthcare? And do you even understand that the patient of 10 years ago is different from the patient of today? And what has made this patient different? It is that today's patient is empowered by something called technology. That the consumerism that is associated with fast mover consuming items has entered into our healthcare market. But we in healthcare appear to be ignorant of what is going on around us. And so when we talk about technology, we talk about it, and this is coming from a person who sells equipment, CT scans and MRIs, and how many new buildings you've filled with equipment. Believe you me, coming from me, equipment doesn't make it happen. People make it happen. And when I say people, I don't mean people that are just skilled healthcare workers. I talk about people who have a vision and who are able to think beyond their nose today, that are able to be innovative in their ideas and use some of the technologies that is around us to harness the opportunities. Now, what is the fastest growing market in Nigeria today? I would say telcos. In the past, it was oil and gas. How does that simple mobile phone affect us in this room? If we take a show of hands, we'll have all arrays of different ideas. To my mind, it is extremely important to understand that that single thing changes us from the analog age, which healthcare is in, to the digital age, which our patients are in. We have to go away from analog to digital. We have to go from the 20th century to the 21st century. And the only way to do that is to use technology and to harness technology. So what technology are we talking about? I'll use a simple phrase. And forgive me for the analogy, but it's the only way I can explain it. How many of us go abroad and want a taxi and have to wait for the taxi in a queue? And in the last 2 years, how many of us can just, from the palm of our hands, call a taxi, and within 2 minutes they're here? Well, guess what? Not only can you do it in Germany and in the UK, but you can also do it in Nigeria right now. I dare you, pick up your phone, go on to Uber, and within 2 minutes, you'll have a taxi out there waiting for you. We need to have Uberisation in healthcare. We need to have some disruptive thinking. It can no longer be business as usual. And to do this, ladies and gentlemen, we must disrupt the way we think. It is not about the way the world is created today. It is not about boxes. It is not about hospitals. It is about solutions. How do we get the solution? How do we get access to healthcare? It doesn't always have to be in a hospital. How do we get it affordable? It doesn't have to be money out of our pocket. We can think of mobile health. Mobile money. How can we make it and make sure we have quality? I tell you, if all of us in this room don't want to change, we don't want to change our attitudes, we don't want to make sure that our patients are at the center of our business, our patients will make us do so. And if you don't, we will continue to lose them to India, the UK, and so on and so forth. A few weeks ago, I went for a conference. And as much as I thought it was one of the most brilliant conferences I've ever been for, I left with a very heavy heart. At some stage, my blood boiled. Why? Is that we were sitting down and listening to these guys, and India was busy planning for our own country. They are doing teleradiology, they're doing telemedicine, they're taking our patients out, they're advertising, and we're sitting down and saying, our dear rules and regulations say we can't advertise. Where are you? What century are you in? You're in the 20th century. For those of us that want to join the 21st century, there's something called social media. You can advertise, not yourself, but you can advertise what you're doing in indirect ways. You can use digital marketing today to talk about your services in the public, private sectors. How many immunizations do you do today? Today we immunized 100 babies. Today we saved 50 lives. Is that not indirect marketing? Is that not still getting your voice heard? Is that not changing the perception of the poor quality in our country? So the old taxi rank was inefficient. It was analog. Today we're talking about digital. It is on the palm of our hands. It is efficient. It is accessible, and it is mobile. Are we ready to take our various professions and businesses to the digital age, to the 21st century? The answer is in this room, and I think the answer is what? Yes. To do that, we cannot do it by just thinking about technology. We cannot play lip service to it. As we're sitting here today, in the next decade, it's not HIV, malaria, and tuberculosis that will kill the average Nigerian. It is cardiovascular disease. 83% of cardiovascular diseases belong to 4 big categories. What are they? Number 1, can anybody tell me? Cardiovascular, 50% of cases. What else? Diabetes is 3rd. Cancer, another 20% of cases. Diabetes. And finally what? We don't know? Sorry? I'm not going to tell you. Part of it is get on your phone and check it. You're only a doctor. You're only a pharmacist. You're only a nurse if you empower yourself. What you learned 20 years ago in medical school, pharmacy school, I'm sorry, it's ancient. Technology has moved on. Our kids today, my son will make a fantastic surgeon. I would make a lousy surgeon. Why? I think I drive well. Actually, I think I drive very well until I got behind the handles of a PS4. And then I was going left, right, and center and crashing all over the place. But today, robotic surgery is going to be the next age. Okay? Minimally invasive surgery is just today. We're talking about the future. So hand-to-hand eye movement, hand-to-hand, hand-to-eye movement is critical. Intuition is fantastic. There's so many new technologies, and our children are better empowered than we are. So we really need to understand and take it. So the first thing today is that we must engage in technology. We must harness the opportunities of technology and make sure we take it back to our individual practices. Use ICT to become more efficient. Drive the numbers. Check those numbers. Check why do we have fantastic hospitals, teaching hospitals, with over 15 professors of medicine, and yet in 1 month they've only done 1 surgery. Put the numbers out there. By the time you put those numbers out there on social media, they will start getting to those theaters because the consumer will change things. But the next issue I'd like to talk about is the issue of how this technology can help us, is the issue of innovation. And when I talk about innovation, we've talked about innovation several times today. What do I mean? I mean innovation in everything. Now, the first type of innovation is innovative finance. Healthcare is not cheap, but we need to make it cost-effective. And to do so, we need to find innovative financing. For those of us in the equipment field, we need to provide you with leasing solutions that are affordable, that are single-digit, that are long-term, where you don't have to acquire all your equipment. If you think, for example, of all the teaching hospitals in this country right now, how many of us, or how many of these hospitals can actually offer oncology services? So in the absence of oncology services in country, we are going to continue to lose our patients. We need to put our money where their mouth is. It cannot be done by the private sector or the public sector by themselves. It is collaboration. We need to have PPIs, PPPs. We need to have the enabling policies to get there, but we need to have the will. We need to build the trust with one another. The second issue is the issue of ownership. We all finish medical school, pharmacy school, nursing school, and your dream is to own your own hospital. That is going to end. Any single man, one-man organization in the next 5 to 10 years will be extinct. It will now become more new ways of doing business. There will be different ownership structures. If you are waiting to be looking for finance, businessmen are already entering into the healthcare space. Private equity wants a 30% return on investment, and you know what? They're going to get it. Though they have to understand that there must be patient capital. Healthcare is not necessarily your oil and gas where you make quick returns. So the cost of healthcare comes at a cost, but over 7 years, 10 years, it's smooth sailing onwards and it's complete profit. So we ourselves here need to orientate ourselves on healthcare being a business and understanding the business language. And that's all part of innovation. The next thing is the issue of concepts of diagnostic centers. It won't be just diagnostic centers all over the place. If we diagnose all the diseases and we don't treat, we haven't helped our situation. So we must have diagnostic and treatment centers. We must have mega hospitals. But the real core will be the fact that because the consumer, in this case our patients, are empowered, home care will become a very big market. Not only will it be a big market, the patients will be empowered. They won't need you to check blood pressure. They won't need you to check their sugar. They can do it on their mobile phone. They won't need you to go to the hospital to do certain things. So it means that we can use technology with public-private partnership. Private sector can help with changing things in the private sector, in primary healthcare sector. Then we can concentrate on those communicable diseases and attacking them. But to be able to do this, ladies and gentlemen, we need to start thinking out of the box. We need to disrupt the way we are right now. I'm not saying that doctors, to conclude, I'm not saying doctors, we will replace doctors with machines, no. But we will make doctors safer. We will make pharmacists deliver safer care. And if you don't want to do it, the patients will demand it. We're also saying that we're not asking you to, we're asking you to embrace this change. This is a season of embracing change. Let us change it from ourselves. A tree was not grown in a day. It starts from a simple solution. Each of us is very capable. So when I say people make it happen, but it means we must be innovative. We must think out of the box. We must do things differently. We must be collaborative. We must embrace technology. We must ensure that at the end of the day, the patient is at the center of our business. Thank you.